Bismillahirrahmanirrahim. Prophet said, action will be judged by intentions and everyone will be recompensed according to what he intended. Greetings everyone, I'm Dr. Mahnoor, working as a PG in Department of Community Medicine in KMU Lahore. Today I'm going to present the topic of public health surveillance under the kind supervision of my respected professor, Dr. Saira Afzal. In this presentation, we will learn what is surveillance, what are the types of surveillance, what is the purpose and uses of surveillance, methods of surveillance, surveillance cycle, difference between surveillance and surveys, conclusion, recent advances, and MCQs. At the end of this presentation, participants will be able to describe the surveillance, type of surveillance, its purpose and uses, surveillance methods, surveillance cycle, difference between surveillance and surveys. So what is surveillance? The ongoing systematic collection, analysis, and interpretation of health data for use in the planning, implementation, and evaluation of public health practice, closely integrated with timely dissemination of this data to those who needed to know. Surveillance ranges from compulsory notifiable diseases, specific diseases registries, population-based or hospital-based, continuous or repeated surveys or representative samples of population to aggregate data for recording trends on consumption pattern and economic activities. The enabling components of surveillance system may include laboratory diagnostic to detect or confirm health condition, in which information technologies to support the surveillance process of data collection, analysis, and dissemination is done. The second one is clinician consultation and reporting, in which clinicians and public health workers will be involved. Third one, laboratory worker education and training, which will lead to legislation and regulation. Policies that support the conduct of surveillance systems and directories for disseminating alerts, clinical guidelines and prevention recommendation, program administration and management, and human factor, multi-sector communication and relationship will be involved. Public health surveillance, it serves as a early warning system for impending public health emergencies. It documents the impact of an intervention or track progress towards specified goals, helps guide health officials and programming, directing and conducting disease control prevention, does not include control or preventive activities themselves. Surveillance should not be confused with medical surveillance, which is monitoring of exposed persons to detect early evidence for the disease. Public surveillance can be done at local level and at national level, or at intermediate, which will be the mixture of both. At local level, investigation of disease outbreaks and specific control activities are done for the infectious disease and environmental hazards. At national level, measuring trends in risk factor of disease, monitoring the effectiveness of specific intervention, conducting more complicated analysis, and risk factors is being done. And in intermediate, it would be the mixture of both local and national. Purpose of surveillance is to establish the baseline of a health condition, understand trends and pattern of disease, detect outbreak or emergence of new disease, estimate the magnitude of health problem, identify resources needed during and after public health emergencies, evaluate public health programs, determine nature and history of disease, monitor changes in infectious agents, set research priorities for public health program planning, monitor changes in public health practice source. So how can we do the surveillance? First of all, we surveillance helps in estimation of health problem, and tells us about the natural history of disease. We can detect the epidemic, Distribution of disease, we can check the hypothesis, we can evaluate and control the preventive measure, monitoring the changes and detect the changes in health practices and facilitate the planning. So first of all is estimate of health problem. Basically, surveillance data help us in estimation of health problem, as it is shown in graph, where in on x-axis is time and on y-axis is the number of cases at that particular time. So we can check the burden of disease at a specific time through the surveillance. We can check the nature of natural history of disease through surveillance. As in this graph, there is again time on the x-axis and the active cases on the y-axis. So we can determine the latent period, active period, and pathogenicity of the agent. We can also detect the epidemic through the surveillance data. As in this graph, we can see the new confirmed cases, old cases, recovered cases. So by data of surveillance, on putting it on graph, we can check also for epidemics of the disease. In surveillance, when disease is reported from the different regions of the country, we can ultimately see the distribution and spread of the specific disease and event. Through surveillance data, we can check the hypothesis. As in this graph, we can see the disease is distributed in males and females, and their age group is mentioned on the y-axis. So we can check the either this disease is more prevalent in specific age group in males or females. So we can make a hypothesis and test on the behalf of surveillance data. We can also evaluate control and prevention measures of a specific disease. As in this graph, there is time on x-axis and the cases on the y-axis. So we can check the preventive and control measures and their effects on the number of cases through the surveillance data. We can also monitor the changes in disease pattern through surveillance data. We can check the health practices through surveillance data. As in this graph, we can see the mode of deliveries, either on home deliveries or in healthcare setups. We further can check either the cesarean or SVDs are done more on public sector or private sectors. Through surveillance data, we can also facilitate facilitate us in planning, as in identify target population in need of health service, identify health topic to be addressed by educational programs and media. Surveillance is basically outcome oriented, and it can measure the frequency of the illness. It can also measure the severity of condition as hospitalization, disability. It can measure impact of the condition as cost. So these are the checkpoint we should apply when we are going to apply a surveillance program. We should check for the frequency, severity, cause, preventability, communicability, public interest, and will that data be useful for public health action or not. When we are going to conduct a surveillance, we first of all define a case. And what is a case definition? It is a specific set of criteria and guidelines used in epidemiology and public health to define and identify cases of a particular disease or condition. Cases can be classified from their source as enlisted downwards. Clinically confirmed cases are those in which any person meets a clinical case definition of suspected disease and cannot be discarded. Laboratory confirmed cases are those that meets a clinical case definition and has laboratory confirmation of that disease agent. Epidemiological confirmed cases meets the clinical case definition and linked epidemiologically to a laboratory confirmed or another epidemiologically confirmed case. There is an example of clinical case definition, and it is taken, the disease taken is measles. Any person in whom a clinician suspect measles, or any person with fever and generalized maculopapular rash and cough, coryza, or conjunctivitis will be labeled as measles. The second one is if laboratory suspect the specific IgM antibody in the in the person, then that will be labeled as the case of measles. Now, surveillance method. What is surveillance method? Surveillance method is a systematic and structured approach to collect, monitor, and analyze data of information over the time. It may include symptoms, lab values, time period, population. Ensure same criteria are used. Make the data more comparable. Include person, place, time. Important to clearly define the condition. In surveillance method, first of all, we collect the data. Data should be through standardized instrument, field tested. On the behalf of data, surveillance can be divided into two types: passive surveillance and active surveillance. In passive surveillance, providers are responsible for reporting. Health department waits to receive reports. Problem with under reporting. Active surveillance provide contacted or regular basis to collect information, more resource intensive, used to outbreak or pilot study. Actually, the passive surveillance is that in which patient itself report to a health facility, while in active surveillance, health worker or organization approaches the patient for that disease surveillance. Here is the comparison between active and passive surveillance. The passive surveillance is inexpensive and can cover large areas, while the active surveillance is more accurate and provide complete data, can provide early and timely data. The drawbacks of passive surveillance is it is underreported scenarios and incomplete data, while active surveillance can be resource intensive and methodology must be well developed. When we collect data, then next step is the data analysis, which can be done through ongoing review, descriptive statistics, or multivariate analysis. Ultimately will be converted to automated analysis. After analysis, data is interpreted and disseminated. The presentation of data in the form of table, graphs, and maps, dissemination data in form of morbidity and mortality, weekly report, surveillance summary, surveillance report, annual summary, etc. The last step in surveillance method is evaluation, uh, in which we check either the system generate need the answer to the problem, was the information timely, was it useful for planners and researcher, was this information worth it to put an effort in, or either we can make effort to put it in a better pathway. Is the cycle of surveillance, which is the collection of surveillance method headings. First of all, we collect the data, then we consolidate and interpret the data, then dissemination of data. Afterwards, we take action to control and prevent. Ultimately, we evaluate and take the preventive measures. So when we are going to conduct surveillance, what the things we are considered: choose a disease that has proved controlled made available, define how data collected shall be used, set a standard case definition, use existing system, visit those who supply data, develop a database, develop a regular reporting system for distribution. Disease selection for surveillance eligibility criteria: that disease should be a public problem, it should be having an impact, should be preventable, we should assess the preventive measures, and should be a risk perception of concern of global health organization and national authority. Here are the prerequisites of an effective surveillance system. First of all, standard case definition, then enumeration of reporting units, then system for disease surveillance, which can be achieved by notifying the diseases through a specific reporting system, laboratories, hospitals, or through population. Disease notification can be done through reporting of cases, through reporting of epidemics, or through obligatory reporting of epidemics. Here are the steps of disease notification. Collect the biased data, compile that data at district, state, or national level, then report that data at district, national level, and then to WHO. Here are types of surveillance on the behalf of collecting data. Focus location for surveillance, such as health facility based surveillance or community based surveillance. Second one is a designated or representative health facility or reporting site for early warning epidemics or pandemic events. Surveillance conducted at laboratories, and then disease specific surveillance. There are a few further types of surveillance in which there is syndromic surveillance. It is used to early detection of outbreaks, to follow the size, spread, and tempo of outbreaks, to monitor disease trends, and to provide reassurance that an outbreak has not occurred. Its objective is to identify illness cluster early before diagnosis are confirmed, and early reporting of the public health agencies. As in this uh, graph, we can see there is time on x-axis and y-axis number of cases. So we can specify our disease and can check the its latent period and its active period, and can take measures accordingly. Then there is electronic surveillance. National Electronic Disease Surveillance is a set of criteria developed by CDC that all public health surveillance system must meet. Then there is sentinel surveillance, monitoring of rate of the occurrence of specific disease condition through a voluntary network or doctors, laboratories, and public health department, with a view to assess the stability or changing the health levels of population. Data collected is in a designed sentinel system can be used to signal trends, identify outbreaks, and monitor disease burden. Data source are those collected through vital registration, disease notification, environmental monitoring, and population surveys are commonly used for surveillance of data related problems. The data sources are vital statistics, notifiable diseases registries, sentinel surveillance, syndromic surveillance, surveys, and administrative data. Interpretation of data. The limitation of interpretation of data is that underreporting, biased, or inconsistent case definition. Limitation of disease reporting is underreporting, lack of representativeness of reported cases, and inconsistent case definitions. These are the reasons by which the surveillance is hindered, or the cases are not reported. Uh, the reporter assume that someone else has reported the case, don't know how to report the case, and concern about the confidentiality of the doctor and the patient relationship, no incentive to report the case. We can improve the reporting by contacting the physicians in community, by maintaining a reasonable list of reportable diseases, by maximizing contact through the presentation, mailings, media, by using the data. These are the characteristics of a good surveillance system. It should be simple, acceptable, flexible, sensitive, should have high predictive value, should be representative, should be time bound, should be regular. The data quality should be complete, reliable, accurate, and the system should be cost effective. Here's the comparison between the surveillance and survey. Surveillance has been defined as a systematic collection, analysis, and interpretation of health data, while surveys is a method of gathering information from sample of people, traditionally with intention of generalizing the result to a large population. That can be done through face-to-face surveys, telephone surveys, self-administrative, papered or self-administrative computer surveys. Surveillance provide knowledge to support health promotion. In contrast, surveys are often done only once to determine the distribution of risk factor in population at a point in a time. Surveillance allows to collect limited number of data, while surveys allows to collect wide variety of data. Surveillance always tries to collect the data on every case of disease, while surveys usually collect data in a sample of population. In surveillance, data collection only is done only for a numerator. We have to get data for denominator from other resources, while in surveys, data collection that allows to calculate the incidence and prevalence of the disease. So surveillance provide information on the health of community. Public health relies on information from medical care provider and takes prevention oriented action based on information, and disease surveillance involves taking information and analyzing, interpreting it, and disseminating it to those who need it. So here is recent advance. This article is taken from the journal elsewhere. Title of the article is Infectious Disease Surveillance in Pakistan, Challenges, Effort and Recommendation. Public health remains a major concern in Pakistan with communicable disease, including HIV, AIDS, Hep B, C, tuberculosis, and a leading cause of morbidity and mortality. Several factors contribute to the country high risk of infectious diseases epidemics, including overcrowding, crowded cities, unclean drinking water, inadequate sanitation, poor socioeconomic condition, and low vaccination coverage due to absence of comprehensive surveillance strategy and mechanism. It has been difficult to manage infectious diseases outbreaks effectively. Now the time of MCQ. MCQ number 1, public health surveillance is one of the methods that a community can use to monitor its population's health by detecting problems at national level. Surveillance triggers which of the following level of activities? A, investigation of communicable outbreaks. B, investigation of non-communicable communicable outbreaks. C, specific control activities predominantly for infectious disease. D, specific control activities predominantly for environmental hazard. E, monitoring the effectiveness of specific intervention of the disease. Answer is E, monitoring the effectiveness of specific intervention of disease. MCQ number 2, the XYZ public health surveillance team evaluate male patient for prostate cancer at a hospital. What form of surveillance is being conducted? A, active surveillance. B, passive surveillance. C, sentinel surveillance. D, syndromic surveillance. E, event-based surveillance. A. Answer is E, event-based surveillance. MCQ number 3, public health surveillance programs should improve the public health system efficiency, effectiveness, which is a key factor in population health from a societal perspective. Which of the following are not typically used to application of public health surveillance? A, identifying and treating each case of malaria. B, helping health officials allocate disease control resources. C, changes in the proportion of children in community with high blood lead levels. D, disease prevention and control program. E, varicella incidence after a law requiring vaccination. Answer is D, disease prevention and control program. MCQ number 4, high quality representative data from government on HIV monitoring system are critical for national HIV intervention, especially among priority population. Which of the following is the most effective way to keep an eye on spread of HIV/AIDS? A, active surveillance. B, passive surveillance. C, sentinel surveillance. D, syndromic surveillance. E, event-based surveillance. The answer is A. Active surveillance.
C.
MCQ number 5. Public health surveillance is in any XYZ country is important to modern public health practice at the local level. Surveillance triggers basic public health investigation of a disease outbreaks and specific control activities predominantly of A. Chronic disease. B. Communicable disease. C. Occupational hazard. D. Presence of viruses in mosquito. E. Non-communicable disease. Answer is
D.
B. Presence
B.
of virus in mosquito. MCQ number 6. Any XYZ country's
कैसे
population health
MCQ?
improvement depends on surveillance. Which of the following statement most accurately summarize public health surveillance? A. Method of monitor occurrence of public health problem. B. A program to control communicable disease. C. A program to control occupational disease. D. A system for collecting health related information. E. A program to control non-communicable disease. The answer is C, a program to control communicable disease outbreaks. MCQ number 7, data information from public health surveillance are used to assess the characterize the burden and distribution of adverse health occurrence. Public health surveillance include which of the following activities? A, disease control. B, disease elimination. D, collection and analysis of data. D, disease eradication. E, disease extinction. Answer is
C.
C, data collection and analysis. Our tuberculosis surveillance was done by an XYZ public health surveillance team by examining hospital discharge data to identify cases. What form of surveillance is conducted in the example? A, active surveillance. B, passive surveillance. C, sentinel surveillance. D, syndromic surveillance. E, event-based surveillance. The answer is
A.
A, active surveillance.
A.
MCQ number 9. ABC countries public health surveillance system produce cancer data and information to assess and describe the burden and distribution of cancer adverse health occurrence. However, the surveillance system of ABC country does not encompasses which of the following activities? A, data collection. B, data analysis. C, data interpretation. D, disease eradication. E, disease dissemination. Answer is B, data analysis. Effective MCQ number 10. Effective public health system in XYZ country collected data in standard method, analyze it often and communicate the result. Which of the following is a common way to collect data for surveillance? A, action research. B, case report. C, quasi experimental studies. D, randomized clinical trials. E, disease notification. So the answer is B, case report. Is the key of MCQ. It is the link of our YouTube channel. Kindly like and subscribe. Thank you.